Okay, so good morning, everyone. I'll be speaking about my experience with Aflibercept, which really in many patients allows very long treatment intervals and has been a big relief from the previously available agents. I'll be speaking about my experience in AMD and PCV. So while this is a talk sponsored by Bayer, this, patient is always first for us. Nothing else is important. We started using Aflibercept in eyes that were non-responding to ranibizumab, and then we realized its strength, speed, and longevity of response. And strength and speed lead to better final visual outcome by preventing foveal damage from chronicity of fluid. Longevity reduces the treatment burden by reducing not only the costs but the risks of endophthalmitis and other complications of each injection. So reduced treatment burden, and most importantly, it continues to enjoy the highest safety of all available anti-VEGF agents with regard to inflammation, occlusive retinal vasculitis, etc. So we also then started finding that several of these patients were able to actually go off therapy totally for very long periods of time and even indefinitely. Like we used to see after we did PDT for non-responding cases, which PDT is not available now. And for these reasons, it rapidly became the drug of first choice for us. We do know that it targets two molecules, the VEGF and placental growth factor, which gives it the strength of efficacy as well as the longevity. We know from Altair and ARIES that 40% of the patients can be extended to Q16 and an additional 20% beyond Q12. And based on this, there was a meeting in UK which allowed practical implementation of a Q4 to Q16 treat and extend pathway with Aflibercept. And there's a recent study from Wilmer Eye Institute which found that 43% of AMD patients treated with Aflibercept could safely stop treatment after 1 year, which is 3 times more likely to happen if they were being treated by bevacizumab. So we'll just see some of our patients to illustrate these points. This is an elderly gentleman with PCV. There is a polyp on ICG angiography at presentation. Initially, he responded to ranibizumab, but then did not come and came back with a reactivation and bleed. At this point, ranibizumab was ineffective even for fluid resolution. Aflibercept, there was resolution of fluid as well as the RP detachment and blood. After 3 monthly injections, the polyp had regressed. And subsequently, there was no activity. We continued to extend the treatment interval up to 6 months, Q24, and then stopped treating him. But he was under observation with no activity and 6/6 vision. So Aflibercept can cause polyp regression. Treatment interval can be greater than 624, and we can stop treatment. Another lady with the PCV, polyp, 5 injections, the RPD settled down with 5 injections of Aflibercept, and subsequently we were able to extend out the treatment. The polyp has regressed completely, and that area has not become active again. This is another lady with bilateral AMD. So I'll be speaking only about one eye. The course of the 2 eyes remains roughly similar. So this right eye, we treated her with Aflibercept because she's already been treated outside with poor response. After that injection, she did not have any reactivation subsequently, the first injection. We still treated her at 4 months, then again after 6 months interval, just to avoid a reactivation. But we never had any activity till just last month, which is almost a year after the last injection. And patient is still asymptomatic 6/6. She just came for the routine follow-up, so we treated her. And you see the octa shows that in this time, the CNVM has completely regressed. So treatment intervals can be greater than Q24 with Aflibercept, and you see here it was 11 months. Each eye was treated with only 5 injections in over 2.5 years, with retention of excellent visual acuity, 6/6 in the right eye. Another one-eyed lady, because other eye lost to AMD. We started with Aflibercept because the other eye had been lost already. And you see there was some reactivation at 2 months, so treated again. But thereafter, this is almost 2 years back, 2.5 years back. Thereafter, there has been no activity. We have treated her once in a while just to prevent problems. But the last injection is over 17 months and no activity, with retention of 6/6. Another lady, bilateral AMD, similar picture. Right eye treated, no activity after that. Vision immediately improves. Activity happened after 6 months of the second injection. So then we decided to treat her at 6 months, though there was no activity. And that was a year back. I saw her a few days before coming, and there is no activity at 1 year after the last injection. So we treated her with 4 injections in over 2 years, and the last interval is 12
Dr.
months.
Mallika, 1 minute to conclude.
Yeah, I'm just finishing. So another patient with a similar picture, a fellow eye of the same patient which did not respond 10 years back except to PDT, and then came back with reactivation, and this time PDT was not available. But with Aflibercept, very few injections, once in 6 months, she has no activity now and a dead tree appearance on Octa, good vision. And this is to show that in peripheral PCV cases, which are also very common, the macula is not involved. Treatment intervals can be even larger because the margin of safety is larger. So to conclude, due to its strength, speed, and duration of action, this drug has drastically reduced the treatment burden in AMD and PCV and other indications. 30 to 40% of the patients can be extended beyond Q16, with gradual weaning off of treatment in many after 1 to 2 years. And most importantly, it has the highest safety of all currently available agents. And we await the high-dose Aflibercept, which will have the 100% safety with 85% possibility of extension to Q16. Thank you.